The last speaker of this morning's session is Dr. Larry Frank. Larry is a professor and the Bombardier chairholder in the Sustainable Transportation Group at UBC. He's also a senior fellow at the Brookings Institute. I have no idea where that is, but apparently it's pretty prestigious. And in his spare time, he is the president of Urban Design for Health. Larry was also one of the key members of our regional steering committee for this conference. So please help me welcome Dr. Larry Frank.
Thank you. It's an honor to be here. I was wondering what happened to those shoes. I knew I left them somewhere. It is truly fantastic to be doing the kind of research and work that I do here in this region. I know different. I have been in other places and worked in other environments and learned how fortunate by contrast, but I would know anyways. Nothing could be quite better than to have Gordon and Penny give their talks before mine, make it so easy for me. The clanger slide makes the case that I think the evidence we need, and to really unpack that and understand where is in the discussion just now on evidence, and how does that evidence really set us up? We're not really just needing to lean only on the health impacts. We've got plenty to work with. We have more to work with in terms of evidence and problems that are coming from the externalization or externalities of the way we fail to account for the health and the climate impacts of the way we're building our communities and we even know what to do with. What we have is a culture in which we're built around the car, and that's what's so eloquently put by Gordon. Many of us would admit and really love their car. It's a great device. But I always said when I was living in Atlanta, I would have really loved Atlanta had I been born a car. And I'm really thankful I wasn't. Being a human looks like a lot more fun. So I'm going to kind of talk a little bit about this image here. Really recently was reminded again just how critical the issue is of climate change, and we're talking a lot about the health impacts. As many of us know, the climate change directly affects our health, or indirectly through the environment. So we have our health, but the health of our environment determines, and you can look right back to the Clean Air Act and to the actual 1967 doctrine for the U.S. Environmental Protection. The Act speaks directly to health. Of course, we cared about it and wrote about it because in order to be healthy, we know we need an environment that will support us. We're really living on borrowed time, as we know. So the first two pieces of this, the first two levers, I call it a global warming gamble, and I say that I had some help with the graphic. I actually am a landscape architect who doesn't get to practice design anymore, so what I do is I work with images of conveying concepts. But technology, cleaner fuels, cleaner vehicles can get us part of the way, and we've run a lot of numbers on this over the years, working in Seattle and other regions, and we're about to do this here. To really kind of back into how much do we really need to change the way we get around, and it's quite a bit. We're definitely going to be looking at the demand side of the equation, and it puts us right back to the active transportation discussion. Just a few words, too many words here. I'll just tell you what it says, but basically, in its knowledge and action, we need to put it together. Working across the sectors is where the solution is, so identifying those win-wins across health, environment, and transportation is essential. Energy is really going to be the key in the future, and it changes really quickly in terms of costs, and being ready to adapt quickly is going to be critical. And then these opportunities to intervene are what's really important. When we build a new rail line, the Canada line, how many took the Canada line from the airport to downtown? So that cost about, I think, roughly $2 billion, in that range, maybe a little less, maybe a little more, we don't know. makes me think of lots of things that cost a lot of money, and it doesn't really cost that much. Now, I admit I'm biased, I'm a researcher, but to actually collect the data on the effect of that before and after on physical activity and on climate change, like we hope to do with other projects here in the future, and will, and others are starting to do, is the evidence we need, because the cusp of the evidence where we're at is what's called, as many of you know, cross-sectional, or that we can associate this environment with this behavior, but we don't have that causal piece as much nailed down. We need it, and it's cheap. It's really cheap. It might cost $500,000, $1 million to do that study. It costs $2 billion to invest in a transit system expansion. The fractional cost is infinitesimal, and it can advise us on the effectiveness and ways to build our future better. That's a pitch as a researcher, though. But the evidence wouldn't be bad to have. So really, the foundation of this, and the way I think about it, is the built environment goes way back to ancient Egypt. We can work with this pyramid quite well. It's a metaphor, but it's real. What we do, how we invest in transportation, the land use decisions we make affect our behavior. It affects not only our travel patterns and physical activity levels, it affects what we eat. It affects who we know, our social capital. So not only physical dimensions, but social aspects of our life that we care deeply about, that really, through the quality of the environments we live, in addition to the quality environments we live in, affect our overall quality of life. And there's indicators that we should be collecting data on that many of us are. And we need to tie our transportation funding to those indicators. And that's what a lot of people are starting to talk more about. So this is one of my favorite graphics. It kind of puts it together for me in a single metaphor, but really on a piece of pizza, you can see, which now, it's really what's the most efficient way to get around from an energy perspective. It probably goes back to the wheel, without the motor, with us, active transportation. And why I call this talk Carbonless Footprints is that we've been doing work to actually just take travel data and convert it into energy, into units called joules, and put in a numerator and a ratio, active transportation to sedentary transportation, meaning vehicle-based, and look at where you get a win-win. It's rather simple, but I'm trying to create evidence in a way that decision makers can converge climate change with health, because if they're not as interested in one or the other, maybe one or the other, we can at least get them to the table. And that's what I think we really need to do, is demonstrate a bottom line. Building a walkable, quote, community out at the edge of a region is a win-lose. It doesn't help. It helps one thing. We need to do better. We need to look at both where growth goes and how it's designed. This is on Thursday of this week, we're having an event to really look at this, but it's really about monetizing. We did a report for the American Public Health Association called The Hidden Health Cost of Transportation, and really the point is that we have evidence of this whole entire set of relationships. We know that how we invest in transportation, whether we build highways or transit or invest in active transportation, affects where growth goes, how it's designed. We know that relates with travel and that relates with health, and that has cost implications. But on the front end of the decision-making process, and Gordon showed the slides of the gateway, those costs aren't in there. We're blind to these costs. And if Penny's slide is right, and I bet it is, the costs that we're ignoring are probably greater than the costs we're even paying attention to. And that's what's really sad. The life cycle costs in terms of obesity and chronic disease onset probably, according to the numbers we're looking at, rack up to making the cost of, we're talking about $2 billion here or $3 billion here, and whether or not when we had the highway built up to Whistler recently widened for the Olympics, there was a choice, a decision to tunnel through the mountain so that the transit or rail could handle the grade, or to go over the top. And the decision was made to go over the top. I think it was a $50 million net difference. But we didn't factor in the costs and benefits that come from transit effectively at all. So that choice was made. What it looks to me like is a fantastic way to develop some amazing land with incredible views in West Vancouver. And I mean, when you drive there, it's really quite an amazing road. But at what cost? Dr. Ballinger Penny made this case really well, but I'll just show, because we've seen this, I have in the US, but here's some slides in Canada showing obesity rates changing. Looks like the text got merged, but you can just get the idea. Over a very short period of time, and I think this is from, I can't read, the top got cut off, but it's about 1995 to 2004 is this window of time. So you can see, just go back through that again. In a very short period of time, 85, well that one shows, and then This one's 94, 2000, and 2004. We've seen an alarming rate of increase in obesity in Canada. And when you start to show the maps, and there's great maps in the US that really got everybody's attention. Here's an obesity map in the US in 2000. It's a behavioral risk factor surveillance system that's used a lot in research. It just shows more than, most states, or a great number of more than 20% of the population are obese and at risk for chronic disease. And I think we got good evidence before on the cost of this. Here's some numbers from the US. Alarming statistics in terms of costs. You can read them yourself. And then I thought I'd just show a map of diabetes in the US and rates of change from 90 to 95 to 2001, really also following a similar pattern to obesity, and very well put earlier today. I get the good fortune of skipping this because it was already conveyed, and move into kind of what we know about the built environment. So there's two things we like to measure, and I think these were touched upon earlier, but when we do data collection, we like to know where people live, and we correlate that with their behavior. So we see in terms of proximity is mixed use and density, and we measure it objectively, and also we like to know what you think. People's perception of the built environment is very different often than what's out there. So if we just measure what's out there and don't know how they feel about their neighborhood, we actually wouldn't understand what's driving and motivating, so to speak, that is, their behavior. So you can see this little squiggly line is a buffer, and we only measure what's inside where they go, where they can get to. So what's over here or over here really doesn't matter, because if you can't get there, it's not affecting your behavior. And we compare people in different communities, and then the connectivity is also measured. So there's lots of different design variables that you've heard about over the years. I think people in this audience are pretty familiar with this kind of stuff. Here in Vancouver, we've mapped this over the surface of the region. We call it a walkability map, but it's actually a transit supportiveness map as well. We've measured this and correlated it with lots of different data sets, and many of you out there are doing similar work. And what's, I think, important, and WalkScore is another tool that does this, looking at distance to destinations. And we work collaboratively with WalkScore, looking at tools and ways that we can actually make it easier for those of you that want to have evidence quickly, can actually get information and use it in your local communities. There's different reasons why we use different kinds of tools, but basically when we overlay them, we see downtown Vancouver, obviously, walkability is a time map. It's unfortunate, but the truth is we're looking at the depth and time. Our other places that are very walkable is New Westminster. That's the only other really looking green spot on the map, and then White Rock and other older town centers. But we know when we correlate this with behavior, it's quite influential. We also drill down into neighborhoods, and you've seen a lot of stuff like this in your own communities where we compare. And I was told when we put this report together, find places in the region other than Vancouver that are walkable, because we absolutely have to show that it's not just an urban center versus the rest of the region issue. And we measure different aspects of this. One of the things I'll point your attention to is this little measure here called retail floor area ratio, which is just the relationship between a building and the street. That's all it's picking up. So here, with a high FAR, or in Canada we call it floor space ratio, you have a lot of square footage on a smaller amount of land. And what that means is there's less surface parking. There's more efficient use of land. And that came up earlier in some images you saw. So it's really measuring how that design variable affects behavior, not just density and mix and other factors. We also know, and I'm going to show you just a little bit of evidence here to make you truly ready for lunch. so you can just see these different factors, and all of these are highly significant in predicting walking. I'll just tell you a little bit of history. In 1985, when I started doing this research, everybody laughed at me and said, "Who cares about studying walking?" I was one of 3 researchers in the US that actually had studied walking, and we looked at walking and transit use and driving in Seattle. And people were like, there's no interest in pedestrian travel. The transportation is about big stuff, trains and building highways. You're just looking at pedestrian travel. By 95 and 96, the Surgeon General's report in the US came out, and then the Heart and Stroke Foundation of Canada as well came out with studies showing that moderate physical activity was critical for the general population, and that walking 30 minutes a day, 5 days a week on average, reduced the likelihood of developing a chronic disease. And then I was approached, and I happened to have been in Atlanta, by the Centers for Disease Control, and we wrote some of the first reports on this topic. How much have we evolved since then? Maybe not so much. But one of the things we're looking at is the relationship between transit use and physical activity. To the point, and I can tell you that by being supported by Bombardier, this resonates well, and in a good way, because it's nice to know that not only does transit help us with a number of objectives that we need to move people, but it also really is directly good for public health. And we found even in Atlanta that people were about 3.5 times more likely to get the amount of physical activity they need if they use transit, because of course they walk to and from transit. So there's a lot of new evidence. This is one of the first studies. There's a whole mounting new body of evidence on the effect of transit on physical activity and health. That's very powerful. And we're starting to see that play out across the world. So now I'm going to, of course, I mentioned that when I was in Atlanta, I was doing a lot of research there, and I showed that driving makes you fat. You may have heard of that study. It was like that was the day that I had someone come up to my door and say, "Get out." Now. So we came across the continent, and then we realized that being south of the 49th parallel wasn't quite enough. So we headed north, and we found this anyways. It went a little differently than that. We knew we were going to come here, but it was just in time. And I have to say that the ire that this caused was so profoundly motivating to me that we have published 20 separate individual studies on Atlanta, and we are going strong. We got like 10 more coming out, and every time I do one, I call the Atlanta Journal-Constitution or the media, UP, AP Press, and they love it because it's like one more study on Atlanta. Well, anyways, there's a lot of good things about Atlanta. Anyways, so age, car time, and being African American or black male and female was associated with increased likelihood of being obese. We found that education level and income, more money, more educated, further you walked, and living in a mixed-use environment or being a white female compared to a white male was associated with less likelihood of obesity. We then learned that the white women underreported their weight. And I was told, not so fast. The white men overreported their height. I would never imagine anybody would do a thing like that. So this was interesting. And then afterwards, there was this numbers. You may have, other statistics like this, but an hour in a car, each additional hour in a car is about a 6% increase in the likelihood of being obese, and each additional kilometer we walk is about a 5% reduction, and that was there. So this has been replicated elsewhere, and these relationships seem to hold. There's now, there's maybe 300 studies on this topic, not just time in cars, but in general on physical activity, built environment, and health. This image came out at the time in the Washington Post showing the more you drive, the bigger you get study. And it kind of inspired me mostly because this little caption over here, perhaps it's time to redefine fossil fuels as a carb. How insightful, 7 years, this was 2004. Of course, I got asked by reporters, well, we're not going to be changing our car use patterns because people use their cars and they love their cars. So what do you suggest they do while they're driving to get more physical activity? And I thought, well, that's too much. That's over the top. So it made me immediately image in my head, those little thought bubbles in the Flintstones? I had one of those, and I immediately thought about Fred and Barney. Well, they're fat, and Wilma and Betty are thin, so maybe there was some truth to that. So one of the things I want to touch upon is youth, and really looking at where our enthusiasm and inspiration needs to come from. And I apologize for the statistics, but I'll just tell you what it says and look for the colors. So what we found in looking at youth, 5 to 8, 9 to 11, 12 to 15, and 16 to 20-year-olds, was across that entire set of age range, at least having one recreational open space in their neighborhood was a significant predictor of whether or not they walk. As they become a little older, 9 to 11, we start to see compactness and density that's merely picking up distance to school. By the time they hit 12 to 15, just like everything else, this matters too. So everything matters too. I've concluded teenagers are out and about. They can actually really get around their neighborhood, and so all the factors of the neighborhood really are highly influential, but yet they can't quite drive yet. At 16, all of a sudden the relationship starts to erode. I guess I don't know if we call that a natural intervention or not, but we started to look at it and it made me wonder, one question leads to another, was we also happen to have information on vehicle ownership. Well, vehicle ownership is enforced by policies that are actually the opposite of wanting to reduce people's car ownership. In fact, the more cars you own, the cheaper every additional one gets to license and to insure. You get a rider, so we actually have a reduction. So we're getting the behavior that we should not be surprised with the behavior we get. So I thought, well, compared to kids who are from households with 3 cars, And remember, I'm looking for co-benefits because this stems over into the climate change argument. If they were from a household with 2 cars, they were 1.4 times more likely to walk. If they were from a household with 1 car, they were 2.6 times more likely to walk and 2.2 times more likely to walk, about the equivalent of the 30 minutes of moderate physical activity per day. If they had no cars, well, that's not fair. So, but I had to know what it was anyways. So one of the things that a lot of researchers have been looking at, and actually I was funded to do this by Jeff Anderson, who's here, who's the director of Smart Growth America, who you'll hear from shortly, and actually when Jeff was with the EPA, and basically looked at distance kids walk. So you can just see, basically once you get past about 1 to 2 miles, there's no walking going on. So all the safe routes to school, and we found here even more so, more profound, was that the pedestrian connections, holding density constant, meaning once it's dense and mixed, what can we do in terms of the route itself? And unless it's less than half a kilometer, there was very little correlation between the design of the environment. Basically, we're talking very short trips. We have to get the land use right around the schools. We need compactness around schools. We need a variety of housing types, and we need to get the school boards involved in this discussion who make siting decisions independently, which completely undermines what we're doing in the biggest way. And you might actually wonder about, and I'll just point these out. Some kids walked really far. They were maybe being punished. So anyways, I'm moving towards wrapping up, but I just want to talk about other things that really matter in the evidence, because I can only just brush across this. In San Diego, we're developing this thing called a Healthy Community Atlas, and starting to look at, indicators to support. Remember the pyramid earlier? Trying to populate that pyramid with evidence and then relate those indicators with behavior to learn what matters most for different populations. Healthy food is a critical issue that a lot of us are looking at. Access, it's not just the type of the outlet, fast food or grocery store, it's what's in them, and looking and understanding about that more. I'm only going to just mention, I think this was covered earlier by Penny and quite well, but basically we're looking at a quarter of our population, this was just in the paper here, being over the age of 65, and where will they want to live? They're going to want to live in places with services, less reliance on driving, and reasons for safety reasons, and maintaining independence and dignity. We also need to be thinking with elderly the cost of service delivery in addition, and maybe that's rolled up in that number. So one of the way to think about it is, where can we make the most impact? Where are our unwalkable places where we have lots of seniors, which is what this is cross-referencing. Air pollution exposure is critical for elderly. We didn't talk about that earlier, but it really is one of the things. It's not how much air pollution you generate as much, but what you breathe. And this is where we get to a real tension with walkability and creating urban spaces. There is good news in this, but basically the air pollution, it's the particulates, the small stuff that leach out of the air right near the roadway edge that we need to look at. But basically, as soon as you get back a couple hundred feet or 100 feet, the air's a lot better. And there's also ways through technology and cleaner vehicles we can solve this, but we really need to worry about that. And finally, on the GHG side, we know that all these factors contribute to less emissions. Just all the lines go down, the red lines, whether we're talking about density or retail parcels in a neighborhood or destinations or connectivity. We're mapping this, and this is what we're hoping to do here, where we predict the greenhouse gas emissions by location. And this brings me to a key point, which is we really need to embed the cost as in the development decision-making process, so that a developer, develop where you want, but it costs us more as a society if you go out here in the red zone, meaning where people will drive a lot more. We have to incorporate that into the decision-making process, and we'll get the decisions that we want once we're able to do that. I'm going to skip this and just mention one thing. I'm only going to tell you what this says, but I have to say this. Okay, in public health, there's something, how many have heard of the Precautionary Principle? That's excellent. So I think we're there. We have enough evidence to act. In fact, we have enough evidence that failure to act is failure on the part of people who are responsible and know are in positions where, just like John Snow thought in 1857, that there was a problem associated with this pump. He couldn't prove it, didn't have unlimited evidence, didn't have confirmatory evidence, but this was sort of the failure to act had greater cost than acting. And we're in the same situation now in the sprawl debate. We actually, know zoning, which is a legal tool, predicated on health, safety, and welfare is used in most locations to separate uses to the point where people can't walk and can't get around without a vehicle, which is causing all these health problems. So zoning, the legal basis of it, is now is a little bit precarious in how it's being used, just to put it lightly. So the question is this machine ready? Are we gonna crank down and shut this off, just like Jon Snow did? And so I reflect back on how I was brought up and thinking. So I get to summarize now at everybody's delight, so you can eat. But basically, really, we need to document the cost and the benefits of our transportation investments. And actually, on research and practice side, really learn to integrate those into our decision-making processes. I mentioned the zoning and then the performance-based funding. Thank you.
Thank you very much. Thank you very much, Larry. The reason we kind of pushed Larry a bit on the time was, well, I'm hungry, and I bet you are too. So you notice that unfortunately we didn't have time for speakers this morning to ask questions, but if you can catch up and during lunch or over the next couple of days, they'd be more than happy to answer questions.
Okay, so Neil and I are going to just very quickly do a running summary, and then I just have a couple of housekeeping notes, and then lunch is waiting for you in the atrium. The first thing, we had a great introduction from the Salish territory from Councillor Wade Grant. Rodney welcomed us all here. The mayor told us the importance of walkability and about building connections to Asia. Gordon Price talked about the importance that no freeways and the Agricultural Land Reserve has had in 1972 to forcing Metro Vancouver into being more dense, and how streetcars really did inform a lot of our planning and how the city's laid out. Penny Ballum argued about the double Scrabble points you get if you have transportation, planning, and health in the same paradigm. The 1-minute presentations, the posters were absolutely awesome, and those folks are all racing down now to stand by their posters in the atrium for you.
No, they're not. They're right here.
They're racing. The advocacy panel talked a bit about their work, and I really encourage you to use them as your resource during the conference to find out more about their work and how it connects to you in walking. And of course, Larry Frank told us all about Atlanta and the fact that driving makes you fat. I did hear you say that, Larry. And that 1 hour in a car has a percentage of making you 6% obese, and men say that they're shorter, taller, and women say that they're thinner. Yes, it's very true. And the more cars you have, the less likely you are to exercise. How is that for a summary? So just a few housekeeping points. We're now pleased to tell you in your the wireless access now works with what it says in the program. And secondly, be sure to view the posters because the presenters are all running down to do it now, aren't you? Composting, we've got compost bins arranged for your food waste, cups and napkins. Lunch is in the atrium. And finally, and the most important thing, you need to get to the WASC before 1 o'clock and look for your traffic directors with the bright red umbrellas, not the pink boots, the bright red umbrellas. And there are 2 errors in the program for the walk shops that are leaving this afternoon. Just to let you know that walk shop number 2 and walk shop number 8 are all going to gather in the same place as the other walk shops today, and that's in the driveway outside the Walk Center for Dialogue. So thank you.
So very quickly, this concludes our opening session. Thank you to you. Thank you to those in the overflow room. Thank you to our speakers, and thank you to Walk 21.